first patient is in 1 North admission in 161B. So he was basically transferred yesterday, as we know, from the regular unit, and I'm just going to be following him for medical management there for his lower extremity cellulitis. Then in 2110A, this patient, 82-year-old male, he came in with acute renal failure, failure to thrive, GI bleeding. He is getting better with dialysis, and family is very hopeful, but as far as his recovery is concerned, he looks a lot better today, actually, and I'm doing a calorie count for him. But also we're having a meeting with the son and daughter today at 1 o'clock with palliative care to discuss goals of care for him.
He's a placement issue. Dialysis chairs are really hard to come by these days.
Okay.
And none of his choices have openings.
Okay, so the thing is, though, we're not sure if he'll need dialysis continuously in long term, because he's getting next dialysis is going to be tomorrow. He's getting a WBC tag scan because his white count is really high, so there's no source of infection.
Okay, just let us know when you know.
Okay. 2114, gentleman with incarcerated inguinal hernia. He has refractory ascites, Hep C. So he's being, I'm arranging for transfer to University of Maryland because he's not responding to medical treatment. As of right now, they don't have a bed, but we're waiting on a bed.
Okay. They sound hopeful.
As far as the bed situation, as of last night, they didn't. So we're.
Okay. It's a good thing he has a nice comfy room.
I know that he's on the list. Okay, great.
Right, his power of attorney is his friend because he doesn't have any family. So I've been updating her. She wants to be updated every day.
Have you tried Bayview?
No, they requested university.
Oh, okay, that's cool. All right, thanks.
And then 3101, patient with acute pancreatitis. He's getting better. He was already seen by addiction counselor for his alcoholism.
He doesn't want to go inpatient to a program. She gave him some outpatient resources.
Okay. So he's getting better. I suspect over the weekend he should be ready to go.
Yep.
Right. 4116, this gentleman came in with a few days history of abdominal pain. From the CT scan, looks like he has ischemic colitis. So I think at some point during this admission he will need to be scoped and get a colonoscopy. I requested the gastroenterologist to see him.
10th is 101.
Yeah, he's on,
He was really weak too, so I don't know if he doesn't start ambulating, but he's been in the bed.
Yeah. Okay. 4123 is a new admission with a COPD exacerbation, so she's relatively stable. 4129, patient with alcoholism came in with acute pancreatitis, again new admission. This 4215 is a readmit with urosepsis, had candiduria last time. He had an indwelling Foley, his Foley got clogged. He's coming in again with sepsis.
Was he still at Allegan City Health and Rehab?
No, he's at home with
He
his wife.
inmated home already?
Mhm.
Okay.
Home nurse at home for the following week. I would think we're going to need home care.
Yeah, we'll need home care when he's ready for discharge, but
Or back to rehab?
probably.
Probably back to rehab.
Yeah,
from
that's
what
what
it looked like.
that's what it seems like for now. He was seen by urology also because they're the ones who were following him for the Foley situation.
Can you put a PT eval in?
Sure.
Thanks.
Next patient in 4217, she's a lady with adenocarcinoma of unknown primary in the pleural space. PET scan, I spoke with the oncologist, PET scan is completely clean. So they don't know the source. They just did the BATS procedure a couple of days ago. They put a chest tube in. Thoracic surgery is deciding when to pull the tube out. But the issue is now she's spiking a temperature of 1 or 2 actually overnight. So I started her on, I drew blood, I did the whole septic workup and empirically started her on antibiotics.
Okay.
Very nice family.
How is she doing? I know she was.
She's
really
very anxious, and she's very nice, but she's
Right.
also very anxious because they don't have an answer for her. They're looking for answers and there's no answer. And
She's
Dr.
got,
Minford, she's
small
got
kids.
5 kids.
Yeah, it's
Well,
awful.
the youngest is 3 years old, so.
Has she met with the
Special needs
oncology
also.
social worker?
Yes.
Is Leslie?
Leslie's involved.
Oh, that's
Okay.
good.
Yes.
Okay.
So they need, the family needs a lot of support. The next patient is an ICU admission. Then in 3210, this patient came in with severe hyperkalemia, chronic diarrhea, alcoholism. So she's getting a stress test today because she did have some cardiac issues. Her troponins were high. She needs to be evaluated before she goes for
I
her
saw that she
EGD.
was NPO for colonoscopy this morning as well?
Yeah,
Okay,
she's
and a
getting
stress
that.
test?
Yes.
Okay. Do you think she's gonna be discharged today or tomorrow, or?
I mean, she may be over the weekend. I don't suspect right away today.
Okay, well,
Okay.
it's Friday, so we should check that.
Right. She's getting a lot better. I mean, she came with a K of less than 1.5.
Yeah, okay, thanks.
I admitted her. Then 171B is a lady with, she has GERD and she also has PE. She's on Coumadin. She came in with, she missed Nexium for 2 weeks. Came in with, heartburn and also hematemesis. She will need to be scoped because she also has been having dysphagia. And so the question is, the Coumadin INR is over 2 still.
It's 2.1.
Yeah.
Does she need to be admitted?
She doesn't meet admission criteria. Can we do that as an outpatient?
Not right now. I mean, she's complaining of severe burning. So she's on VID for tonics.
Is she able to take PO, like now, is she eating?
We're starting her on a diet right now.
Okay, so that's the only thing we'll have to see if she's tolerating the diet. Just, we may have to do the EGD as an outpatient. I don't know, unless we can figure out how to,
Put her in a box.
well, no, but how to explain why she's still here under ABS, unless you think, they think they'll scope, well, they can't scope her till.
Well, they
the
have put her
INR's
on
done.
a schedule. I mean, giving her vitamin K right now, I could do that and order that. I don't think it's gonna drop the INR necessarily dramatically.
No, it'll still take a
yeah.
day or two.
So they have tentatively scheduled her for tomorrow.
Okay.
But she's complaining of, like, her heartburn is really severe. And she was NPO till yesterday, like, really clears.
We
Um,
could send it to the physician advisor and see if he'd approve an admission.
I'll do that.
Okay.
That was one other option.
Last
The last one is 172A, gentleman has been on frequent flyer with, he's doing better. We tried something, we did some research online, the gastroenterology and I and the pharmacy student together.
About his hiccups, chronic hiccups.
Yeah, so we tried some iron thorazine yesterday in addition to the PO. Also, there's a case study that shows that Coreg has dramatically eliminated hiccups in somebody who
No
has.
kidding.
Yeah, so his blood pressure is high, so I tried him on that.
Really
But-
digging. That's awesome, I like it.
Yeah, I mean,
That's an old treatment.
yeah, actually, I had the pharmacy student and I, we sat together and we
Oh,
were
she
doing-
probably
and then
loved
Dr.
that,
Dr. Diva
yeah.
joined in, so we were all there doing research on it.
If we fix this guy, we'll have to do a case study and
Yeah.
and publish it.
Yeah, I mean, for him, the option is also surgical, of course, in Furushi Center, but.
He's self-pay, he can't have surgery.
Yeah. Unfortunately.
It's dangerous too with his, as
Yeah.
frail as he is.
Exactly, so.
Oh, that was.
Good call, thumbs up.
All right, thank you.
Thank you.
It used to be that years